Hello, friends. I'm Dallas Peterson. I'm the pastor at Lindsborg Trinity United Methodist Church. And, a little funny thing happened, I guess. You've probably all heard the stories of how the dog ate the homework, right? Well, my computer ate the sermon. So I'm going to go with notes today and try to make some sense of all of this. By the way, my dog, I have a little 3-month-old miniature Australian Shepherd that we have named Slugger, and probably should have named him Scamp, but Slugger tried to eat my book, tried to eat my Preaching in the Purple Zone book, and I caught him before he got too far with that. So, he's still alive today, so that's a good sign. The reason I have decided to go ahead and do this Purple Zone training, I have a couple reasons for that. And one of those reasons is that I just believe that our church is kind of divided. And we do have the people on the left and the people on the right, and it just seems like if we can work a way of preaching this and having the dialogue and then another preaching about it, that maybe we can bring people a little bit closer together. And another reason I decided to do this also is because I think it will help me in the way I preach and what I preach about. Now, I have decided to go with health care as my option of choice, looking at health care, because in America today, one of the chief concerns of Americans throughout our country is how do we pay for health care? It's so expensive, getting more expensive all the time. And so I saw that option to look at and thought, that is something that I want to pursue. And I've asked people to help me in my church. One is a woman that works at the hospital here in Lindsborg. Another is a retired elder in the United Methodist Church and did clinical psychology work as well. And both well educated, and I met with them last night, and we had good conversation, and they brought up some things that I really had not thought about. But for the text for today, I want to take a look at Mark chapter 6, verses 53 through 56. Jesus was a healer, and he was the health care of his time, I guess. But there are several places in the book of Mark that talk about the healing that Jesus did. And I chose Mark 6, 53 through 56. Please hear the reading of the word. When they had crossed over, they came to land at Gennesaret and moored the boat. When they got out of the boat, people at once recognized him and rushed about the whole region and began to bring the sick on mats to wherever they heard he was. And wherever he went, into villages or cities or farms, they laid the sick in the marketplaces and begged him that they might touch even the fringe of his cloak. And all who touched it were healed. May God add his blessing to the reading of the word. And so Jesus, the healer, as he walked through Galilee, went from town to town, village to village, hut to hut. Why, he brought healing to all that came to him. And even those that touched the fringe of his cloak were healed. He healed, I would say he healed thousands of people during his ministry. And what a blessing that was to all those folks that had that healing, that came to them. Of course, people in Jesus' time, they didn't have insurance, they didn't have Medicare, to help them through the difficult and hard times of bringing healing. And so he was the insurance for many people. But I've thought, well, what about those people that didn't have a chance to see Jesus? Those people that, so many that didn't have that opportunity. What happened to them? And, of course, they probably, a lot of them probably died young. They probably had physical ailments that could not be healed. And so that's part of the reason that I chose for this sermon was health care. How can we bring costs down while getting the care that we need? And so in our world today, in our country today, one of the most important concerns that we have is how do we pay for our medication? How do we pay for hospitalization or doctor visits or seeing specialists? And of course, a lot of younger people don't have that worry. I think back on my lifetime, and as a younger person, I very seldom, if ever, went to see a doctor because I was in good health. But not everybody is that fortunate. And so how do we pay for those health care costs that are almost insurmountable in so many ways? I looked at the article that I found on the NIFI website about health care. And in looking at that, I saw some things that I hadn't realized before. And it talks some about Medicare. And I just want to throw in here that if it weren't for Medicare, I don't know where I would be today. Because the last year has been very difficult. I've had some things happen to me that I never dreamed would have happened, and been in a lot of great pain as a result of that. So I just was so thankful that Medicare was there to help me through that difficult time, and doing so much better today, doing so well today. But if I hadn't have had that help, if I hadn't have had that insurance for Medicare, I don't know what would have happened. So it is something to be very thankful for, and I just feel very blessed that I live in the United States where I have this Medicare that is available to me. But, in many other countries around the world, there is wonderful health care at a much lesser cost than what we pay out here in the United States today. So, that's something for us to be concerned about and think about, because there are many, many countries in our world today with lower health care costs and better health for their citizens. Now, there were three options that this article looked at, and it certainly didn't address all the options that are out there, or all the ideas that are out there. We have anywhere from faith-based insurance plans. It's not really insurance as we understand it, but there are faith-based plans out there, and people are using them. But the three that we looked at in this article were three options. One of them is to ensure health care for all. Second option is build on what we have. And the third option is let people make their own choices. And we want to take a look at those here today very briefly. Ensure health care for all. It could help prevent death, such as what happened with a young man by the name of Alec Smith. Was only 26 years old when he fell into a diabetic coma, and he died alone in his Minnesota apartment. And his mother discovered him. Of course, it was too late. And what he had done was he was on insulin, and what he had done to cut his health care costs was to start taking less insulin, maybe one treatment of insulin a day less than what he normally would have. And it, you know, he kept bringing it down until it was just too much for him. And so he died alone in his apartment in Minneapolis. He was thinking maybe I could take a little less insulin. And that was not the answer for the young man, and it was a sad way to come to the end of his life. I just want to read this little piece out of the article. It reads, "The patchwork of private and public plans we have now leaves too many people like Alec falling through the cracks. At 26, he was too old for his mother's insurance, while his insulin cost $300 a month. His restaurant job didn't offer health benefits, and he earned too much to qualify for the low-income Medicaid program or for the subsidies that would have made an individual policy affordable." And so, yeah, health care for all. Why not? One of the things is that it would be a staggering cost to do that. I mean, health insurance is already so high, but what if we had a plan like Canada does, or France or Germany has, where everyone would be insured? We might find that the costs are less overall and that people would be healthier. So that's option number one. The second option was to build on what we have. You know, since affordable health care came in, the amount of uninsured people in the United States has gone from 44 million to 28 million. So still 28 million is too many, but it sure has improved from that 44 million. So the idea on this, build on what we have, is that we fix what we've got, that we go through the process of fixing what we have and improving it. You know, we still would have daunting costs, high premiums. People would resort to high deductible insurance due to the costs that they can't find. You know, because costs are so high, they're going to find every way they can to make it less expensive. One of the arguments for this also is that the most expense from Medicare or insurance comes in the last months of one's life. We could say expand Medicaid, and that would be good if we could expand Medicaid to take care of all of these folks. But again, during the last few months of one's life is where the most cost comes about in Medicare and in Medicaid. Another thing that they brought up is exercise. Well, 40% of Americans are obese. And, you know, just lack of exercise, lack of eating in the right ways. And we could compare that. Now, remember, 40% of Americans are considered to be obese. And if we compare that to Canada, why 28% of Canadians are considered to be obese. And in Germany, it's 23%. In France, it's 17%. And in the Netherlands, 12%. Why can't we do the things they are doing in those countries? And the thing to remember also is that they all have far lower health care costs, and they're all healthier. The people on average are healthier. Living so that the end of life care costs are less, and hospice use, use hospice use instead. Most Americans, I want to bring this up also, most Americans say that when near death, when people are near death, I talk about myself, if I would be near death, I would not want to extend my life if there's no hope for it becoming better, having a quality of life. We look now at option number 3. Let people make their own choices. People want to hear this from politicians that they can address these issues by lowering health care costs. Bring the prices down, they will say. Don't pay for coverages that they don't need. Make their own choices. People want to have enough health insurance to avoid a medical catastrophe, to pay for a medical catastrophe, but they don't want any frills. It would cost less, but there would be fewer benefits as well. They also want to have plans that are publicly available and easier to understand. You know, I've looked over health insurance and home insurance and all of that, and looked at policies, and you know, I think for the average person, and I'm very average, why I think that if it were easier to understand, it would make it much better. And you know, it seems like people make choices, but they don't always know what the best choices are. But they just want to buy plans that offer fewer benefits. The argument is that it's not fair to people who are young and healthy to pay insurance costs for things that they'll never use or they don't think they'll ever use. Things happen in life, and sometimes you need to have that insurance coverage after an auto accident or a heart attack or whatever. Why, you know, young people have heart attacks. Those things happen. But one other thing that was brought up too in the option number 3 is that people want to know the costs before medical treatment rather than after, and then to negotiate those costs. You know, how many times have people had an insurance plan, they've gone to a hospital for a procedure, and then they get the cost of it later. They would like to know beforehand what those costs are and possibly negotiate a better plan. And so those are the 3 options that were brought up in this article, and each one of them have very good plans out there, but they all have things that could be improved and maybe improved a lot. Oh, Jesus was a healer, and that was a wonderful part of his ministry, that he would be able to heal. And today, well, of course, Jesus is not here physically to bring that healing, but I believe strongly that Jesus works through our medical people. Jesus works through doctors to help bring a diagnosis that will help someone recover. You know, as I mentioned earlier, this past year was very difficult for me. And if it had not been for wonderful medical people, doctors who knew what they were doing and helping me in recovering, where I'm back to my old self, why, what a blessing that was in life. That I had people like that, because if I hadn't had that, as I mentioned, I just don't know where I would be today. But I truly believe that God is at work in each of those medical people and making the right decisions and choices to help others out. But with the extremely high cost of health care, it makes it hard for low to middle class income people to afford it, and many opt out of insurance because they just can't afford it, and they don't have any insurance at all. I know that you feel this way, and I feel this way too. Jesus would not want that. I don't know if we as United Methodists and Christians want that at all either. We should look at other options and perhaps some that are faith-based. There is no easy answer, but it seems that there should be better ways and less costly than what we have today. My prayer is that God will be with us and help us to find a better and less costly way to stay healthy. God bless you all. Amen.